Okay, perfect. So to kind of jumpstart it all, could you please give us a little glimpse into your background and what your role is in FAU, please?
Sure. My name is Dr. Stuart Goldman. I'm a child and adolescent and general psychiatrist. I've been at FAU since 2016 at this point, where I came to help do faculty development, also help launch a residency program, which I ended up doing in psychiatry. I teach M1s and M2s. I do faculty development. I run the Educators Academy. I do a bunch of other things as well. And I've been practicing child psychiatry since the early 1980s. For the bulk of my career, I was a faculty member at Boston Children's Hospital and at Harvard Medical School, where I did undergraduate medical teaching. I ran a fellowship in child psychiatry. I
Mm.
ran the diagnostic services. I mean, one of the things about being sort of at it for a long time is seasoned, is I've had lots of different experiences in different contexts. I was doing a course from medical educators, and Dr. Sarah Wood was taking the course. And she said, would you be interested in a job at Florida Atlantic University? And we struck up a conversation and I ended up down here now about 8 years ago.
I love that. Thank you so much for sharing. And kind of jumping into your medical background, is there anything in particular that led you to specialize in psychiatry?
Well, I mostly have worked with children, adolescents, and families, although I do see adults as well. I've been particularly interested in depressive disorders in children, and I've written about that, suicide and other things like that. I've also been really ran the diagnostic services. So one of the things that was a privilege of working at Boston Children's is the common things were common, but the uncommon things were not that rare. As a major referral center for the Northeast, I got to see interesting and differing patients from all parts of the Northeast as well as often in the world. I had the good opportunity sometimes to be flown to different parts of the world to help with families sort out some of their problems.
Are, do you mind sharing what places you have kind of visited and what cases you've seen most commonly?
Well, I mean, they always were children.
Hmm.
I've been to Italy and to France. Some of those families were international families. Some of those families were located there.
Hmm.
I had a steady stream of patients from Bermuda and the Bahamas for a period of time. But most of my patients were from the Northeast. And, the typical patient who comes to see a child psychiatrist is having a pretty hard time because it's pretty hard to get to see child psychiatrists. There are not enough of
Right.
us. So that typically they are having major behavioral problems, major self-regulation problems, mood problems, and then sometimes thought disorders or developmental disorders. Things
Mm.
like autism, autistic spectrum on the developmental side, and thought disorders like schizophrenia.
Interesting. And kind of shifting gears a little, is there anything in particular that you find rewarding in your career as a psychiatrist?
I think the most rewarding things are watching people grow and change over time.
Yeah.
So that from a clinical perspective, I think that's the most rewarding. And I have patients, I'm going to see a patient later this week who I began seeing her when she was in college and had a problem with substances and ended up having to leave college. She's now a woman in her 50s with a master's degree, two children,
I
productive,
love that.
active life. And we meet intermittently over time. So that we met intensively when she was first having difficulty for the first handful of years. And then we've met intermittently since then for pushing 35 years at this point.
I love that. That's wonderful to hear. And that kind of leads me into my other question, my next question. How do you build a relationship with patients, especially kind of those that might be a little hesitant to seek help?
Okay. Great question. I think that you have to meet patients where they are.
Hmm.
So I think really listening, I think is a skill, and it's sometimes a lost skill and for physicians. I do a lot of medical student teaching, some of which will go into psychiatry, the majority of which will not. And really listening to patients and trying to understand where they're coming from. So one of the things I encourage students to ask patients and their families is, gee, Mr. Jones or Ms. Jones, how can I be most helpful to you today? I know you're here because of blank. How can I be most helpful? And
Hmm.
that lets the patient know that you're really listening, and hopefully going to be able to address what they want to be the outcome of the meeting. Excuse me.
Thank you. And is there any case throughout your career that you found particularly like challenging? And if so, what were some certain things that you did that you kind of handled it with?
Well, it's I can't really speak of a specific case. So I'm going to
Of
speak in
course.
somewhat
Yeah.
generalities. For a period of time, we had an active, rather sexual abuse treatment team at
Hmm.
Boston Children's. So these were kids who were victimized by almost universally adults, sometimes older children or adolescents, and working with perpetrators of sexual abuse. So not the victims obviously were hard and tugged at your heartstrings, but working with perpetrators where you feel like um, it's hard to imagine any kind of context of being empathic with they are in their lives.
Hmm.
But usually people who are perpetrators have a story as well, and trying to find a way of listening to that story and blocking out in some ways um, all these sort of noise that sort of you generate because of anyone's normal feelings for someone who victimizes children. I think that
Right.
was probably one of the most challenging things.
I understand. And shifting gears a little, I would like to talk about the topic of mental health. And
Okay.
it kind of surrounds what FAU Thrive mostly focuses on. And we were wondering, how do you manage your own mental health in order for you to prevent burnout in your career and your life?
Well, I think really good question. Balance. So my background is actually my flowers. They're not actually at this moment, um, but they were at a moment when they happened to be Vanda orchids. When my orchids were particularly happy. Um, and whether I was in Boston, the greater Boston area, or here, having some balance. I have three children, three daughters, and being fairly active in their lives. They're now all grown. One of which is actually a physician herself. Being actively involved with the family, having hobbies and interests, striking a balance. Um, I think really makes a difference over the long haul. I often say to people who are going into medicine, but this is true of all professions,
Mhm.
it's a marathon, not a sprint. So you really have to think about, how are you going to be in it for the long haul, um, and pursue the things that you love.
Yeah.
Um, you know, um, uh, well, I'm a physician. I worked particularly when I was in Boston, with social workers and with psychologists, uh, and particularly enjoyed that sort of balance of interprofessional contact. But
Mhm.
having interest in striking balance, I think, is um, uh, the antidote for burnout. Uh, I also like to exercise. So I have a small gym in my house, and I had, one of the nice things about doing that is it's about 9:15 here this morning. I could get up a little bit early, work out, and still be, on Zoom by 9 o'clock.
Yeah. Love that. Thank you so much for sharing. And um, in regards to kind of like working with college students, is there any way that you've seen them experience burnout? And what do you kind of suggest they do in order to kind of protect their mental health and make sure they have a healthy
Sure.
one?
So when I was in Boston, particularly,
Hmm.
I worked a lot with undergraduate scene. Boston has a large university scene, both public and private, and it was really thinking about um, a couple pieces of advice. Advice is sort of embrace a little bit of structure in your life, in the sense that college can be sort of overwhelming. So sort of figure out how you're going to, in a foreshadowing kind of way, plan things out a little bit, not in the way that life becomes regimented and overly structured.
Hmm.
Um, and find the things that you're passionate about. Um, Develop a peer group. Um, most faculty is so peer group who sort of brings out the best in you. And the other thing is, cultivate faculty relationships. I think that most faculty, myself included, love having coffee with students, or chatting, or being in some ways thinking about, gee, what made a difference in my own life. uh, I went to college. I went to MIT in Boston a long time ago at this point. And I struck up a conversation protesting against the Vietnamese War. It was the last time there was this much unrest in the country.
Hmm.
Um, and sat next to the person who was the chair of the Department of Psychology at the time. And he and I struck up about an 8-hour conversation. And that friendship went from my freshman year until I graduated. So,
That's wonderful. That's wonderful to hear. Thank you. And uh, I was wondering, in regards to kind of your field in psychology, this is also shifting a couple gears. Do you have any strategies do you have any recent developments in the field of psychology that you find most exciting or promising that have like recently been published?
well, again, in some ways, people, so I finished medical school about 45 years ago,
Hmm.
um, and that I would have thought the science of psychiatry, psychology would have advanced more. And
Hmm.
I think that one of the differences that I've seen that I particularly appreciate is that the embracing of evidence-based interventions has become much more the mainstay and the norm as opposed to people flying by the seat of their pants.
Yeah.
So structured psychotherapies for anxiety, depression, PTSD, I think have all made a difference. Um, I review for a number of different journals, and I'm one of the associate editors of one of the major journals in psychiatry,
Mhm.
child psychiatry. And the quality of scientific papers now, um, I think have improved a lot. I don't think that we've advanced as much as we would like to.
Mhm.
Um, I often say to medical students, um, be humble uh, and about what we think we know and what we don't know, because what seems to be true in 1992 may or may not be true in 2024, and similar to
Yeah.
2024 and 2044. I think that we're just not always sure what we know. So I think being mindful of that. The biology of mental illness um, in general, and the biology of stress is still relatively poorly understood. Um,
Hmm.
I think some of the work looking at the role of cortisol, which is an adrenal corticosteroid hormone. So
Hmm.
it's a stress hormone. When your body is stressed, you produce cortisol as a way of helping your body combat stress. Um, and a little bit of cortisol is critical, because if you don't have cortisol, you have trouble fighting off infections, et cetera, et cetera. Too much cortisol is associated with a series of, and too much stress with a series of autoimmune disorders, mental health disorders. It's bad in general. So it may be a exciting sort of pre-frontier about ways in which we can help people who are under adverse circumstances,
Hmm.
um, by moderating their cortisol levels to not have some of the downstream unfortunate sequelae of stress. So adverse childhood experiences, ACEs,
Hmm.
are something that we know predisposes adolescents as well as adults to all kinds of illnesses. So if we could think about ways in which going and doing that would make a difference.
That's
Me
so
personally,
interesting.
I you know I'm a strong advocate for mental health resources.
Hmm.
Mental health resources in the United States has been under-resourced. There's supposed to be parity between healthcare and, for instance, for diabetes as well as for depression, and in terms of expenditures, and there's not. Um, so I think, and the distribution is a problem. So I think that there's two combinations. One is that there's not enough mental health services, and the second is that there's not enough equity in terms of the distribution. And hopefully we'll see that change over time.
That's so interesting. Thank you so much. And would you mind discussing a little on your views in the role of medication in mental health treatment?
Sure. This sort of is a little bit of foreshadowing. I always sort of say to um, residents and medical students,
Hmm.
you know, if we ask a patient, is the medication helping? And they scratch their head and say, I think so, Dr. Goldman, then that's not good enough. So first thing is, if we're going to use medications, we have to have a clear anchor points of what's going to mean success and what's not. With that said, the appropriate use of medications for the disorders that respond well. So for instance, attention deficit hyperactivity disorder, or ADHD, responds particularly well towards stimulants. Um, and that's a disorder where people who have significant ADHD and ask them to go to school or function in life is asking, I'm not nearsighted, I'm farsighted, but it's asking
Hmm.
like people who are nearsighted to go to school and look at the classroom board and not be wearing their glasses. So I always say to parents and people, think about it as glasses. Medication for depression and anxiety is moderately effective. And again, so we're thinking about a law of proportionality. For the people who have mild anxiety or mild depression, medication is not indicated. For people who have moderate to severe depression or anxiety, medication is. And then I think there's a conversation between the patient and their physician or their prescriber about what would be the signs that we're on the right track and it's working, versus what would be the signs that we're on that's not being helpful. Medications for major mental illnesses like schizophrenia or bipolar disorder are um, effective in the sense that they help people normalize their lives to some degree. Um, but many of them come with a handful of side effects, sometimes quite serious, that have to be monitored. So the bottom line is judicious, evidence-based, appropriate use of medication for people with significant disorders. I'm all for.
Mhm.
People who are, I'm going to call it pill sort of manufacturers, pill mills, I think is a problem. And there are some physicians who basically, if you come in, I'll give you a script. And I think that's poor care.
Mm. Is there any way that you suggest we combat that issue?
Besides physicians monitoring themselves and
Yeah.
doing, it's an interesting phenomenon because medicine in general is sort of, people are not looking over, I mean, unless you're a surgeon, in which case you have a whole group of people in your operating room with you. People are not looking over your shoulder, whether you go to the psychiatrist or the internist or the pediatrician or the OBGYN. Mostly, you're not. So it's really around physicians embracing the evidence-based care and making sure that they do right by patients.
Mhm.
Um, I think patients should feel empowered. I want patients to be my partner. So I want them to say, so Dr. Goldman, could you explain this a little bit better? Because I'm not sure. And
Mhm.
my job is to understand where the patient's coming from, make sure that she or he understands what are our options, and then discuss the pluses and minuses of the different paths we might take, and
Mhm.
then make a joint decision and follow that path, um, with anchor points, you
Right.
know, so if you went to uh, a piano teacher to learn how to be better at playing the piano, you would have a series of pieces of presumably increasing difficulty that would be milestones to monitor whether your piano lessons are taking you where you want to go.
Mhm.
Similarly, going to a physician, whether it's for a shoulder injury or for depression, you should be able to map out a path about where you want to go.
Yeah, that was beautifully said. Thank you so much. I appreciate you sharing that all with us. And collectively, as a Thrive team, that was all the questions we had today. But we wanted to thank you so much for spending your morning with us and answering the questions we had prepped for you. Um,
Okay.
and as a last thing, do you have any questions for us before we depart?
No, I think that whether, my career has been in mental health,
Hmm.
but, I think that being in a field, any field, where, you know, you have an opportunity to watch and contribute to the well-being of people around you, I think is such a rewarding field. It isn't always, physicians do well economically, but, some fields that do that do not do well. So for instance, being a teacher is a wonderful field and extraordinarily important in the world. And unfortunately, we in the United States particularly undervalue and underappreciate that. Um, the other thing I would say, since hopefully maybe some young people will listen to this, is regardless of what your political affiliation is, and being from Boston, being a psychiatrist, you probably can guess mine. Um, but go out and vote. We're sitting on the cusp of an election. Whether it's whatever the issues you believe in, the way that you voice your concerns, whether it's for health, mental health, women's rights, gun rights, on any side of the equation, go out and vote and make sure that your voice is heard. So,
Thank you
all right.
so much.
Okay. All righty.
All right. Have a good day. Thank you.
Thank you. Okay. Bye bye.
Bye.